Good evening, everybody. You're really very, very welcome to this evening's Let's Talk Equine webinar. And huge thanks to all of you out there who've taken the time to join us this evening. We really, really appreciate that. And I'm joined this evening by two really busy ladies in the middle of their really busy season, the busiest time of the year that we could probably, I would say, call on you to be here. So really appreciate both Sue Salter's, Dr. Sue Salter of SES Equine Services, and Dr. Aoife Osborne of Osborne Farms and K&A Farms. So really appreciate both your time here this evening. Thanks for that and welcome to you both. So a little housekeeping for our viewers at home this evening before we kick in. Just to remind that, I suppose, to introduce myself first for those who may not be familiar to me, I am Wendy Conlon and I work with Teagasc as an equine specialist, and this series has been going on pretty much since almost the start of COVID now at this stage. And yeah, so I suppose to say that we are recording this evening, and the intent is that the recording will be made available on the website at www.teagasc.ie/Let's Talk Equine in the next couple of days. And yeah, I suppose before we kick in, ladies, I think that are you okay? Are you happy enough with your screen and everything there? I'd love maybe before we actually start into talking about our topic this evening, which is optimizing mare fertility, if we could maybe to begin with just get a little bit of an insight into both of you in brief. But if I come to yourself, Sue, first, maybe to tell us a little bit about what your day-to-day involves, and you know, yeah, if you can.
The day-to-day basically starts anywhere from 5:30 in the morning through until about 7:30, 8 if I'm lucky. And it begins with scanning mares on a thoroughbred farm. And then at this time of year, obviously thoroughbred work up until the early afternoon, and then on to sports horses in the afternoon. So obviously sports horse stuff is kicking off now, and the thoroughbred side has been going since the beginning of the year. So and loads of scans, loads of scans, loads of foals. Sorry about that.
You are on call this evening as well, and we're praying that you know, everybody leaves you alone for the next hour.
So that's basically what my day-to-day entails. It's all repro work and stud work, so everything involved on the stud from mares, stallions and the foals.
You've collated a lot of experience abroad as well as here at home and over in the UK, and you've done an awful lot of repro work both on the thoroughbred side and on the sport horse side. Yeah,
so I did 8 back-to-back seasons between the UK and Australia, and I did a stud season over in Al Shakab in Qatar, and eventually made it home and set up the practice 2 years ago.
Come to roost.
Oh, there you go.
And I suppose the beauty of this evening is, for me at least, is actually the joining of the two entities that are so important in working together to actually achieve the outcomes that everybody's after, which is the pregnant mare at the end of the season and rolling into the next. And Aoife, you know, you are a breeder. You're a breeder in your own right, but you're also, you know, somebody who looks after other people's mares as well too. And you're somebody that sees mares coming in and out to the farm as well. So maybe tell us a little bit about you know, your setup and what you do on a daily.
Yeah, so we have 15 to 20 broodmares on our farm. We also have clients' broodmares, and then we have mares that would come in that would want to see Sue specially as well. We foal our own mares and we foal clients' mares too. So we're busy at the moment foaling, and will be, I think, all the way to August.
I hope Aoife doesn't phone me with an emergency in the middle of this this webinar.
Not allowed, not allowed, not allowed.
And then I spend a lot of the day following all the protocols that Sue would leave for each of the mares. So So it's busy and there's lots of work to be done, and Sue would be on the farm nearly every day. And yeah, so it's
the teamwork that we have going on I really enjoy, because I'm able to send some of my clients mares. Like, I have some people that mightn't have stocks, or they have complicated, difficult mares that need treatments at midnight, and varying hours throughout the day. So my work is to go in and see the mare. It's actually only a very small proportion of the work that's involved, and then it's great to be able to have someone like Aoife to trust to follow up on all the things that I ask. So works really well.
Yeah,
both aspects of what you do are really, really important, you know.
Yeah, and then I get to see what Sue does as well. So definitely, since working with Sue last season, like, I have got so much knowledge, because before it was just what our mares were doing, whereas now we see a range of different mares and what they come in, and like, I can see what Sue does, and like every day I'm there when she scans as well, so I can see the magic of how it's working. So all of those injections I'm given, or the lunging or whatever I need to do, I can say, oh, it worked today. So you can see the benefits of it.
And I suppose in your seat, because of the fact that you see so many mares as well too, it makes it easier for you in a way to see that, well, what I'm doing, it is actually working, or you can see the reward. Like, it can be difficult, I guess, sometimes when a breeder has the one mare or the two mares at home and they're experiencing difficulties, you know, in cumulative years, and that's a harder seat to be in, maybe, if they're not maybe getting sometimes the right advice or the right actions to go along with that, and it's not improving.
Very easy to see the outcomes. The mares are either in foal or not in foal, one or the other. So the biscuits.
Absolutely. And I suppose to mention to viewers here this evening, as much as we appreciate you being here and actively being here, what we would really love is if you engage with the conversation with the ladies this evening. We are going to, I suppose, we have a little bit of a plan, in the sense of we have a couple of little, I suppose, case studies, scenarios, examples of what you both come across and engage with. But we would love if those of you who are viewing in this evening would actually also submit your questions, your scenarios, your, you know, asks of what you'd like to get out from this evening's conversation as well too, and your own issues and questions. And the Q&A tab is there for most people. That is at the bottom of the Zoom screen. So please do engage with that. Aoife, if you wanna
So I'm Aoife, and then this is Sue. We had a really good or long discussion about like what we should include today. So like, obviously we would love for people to interact and for us to try and answer their questions the best as we can. But for in between, we've decided, we picked out kind of some of the most complicated mares that we saw last season, or a variety of them.
We've tried to pick out we saw a lot of mares last season. We saw a lot of mares in the off season. Yeah. We didn't stop looking at mares for the entire
long time.
Aoife had maybe December off, and that was about it. So we've tried to pick out cases, because obviously reproduction is a huge topic, very difficult to get it all in 1 hour. So what we've tried to do is pick out case studies and certain cases. Some of them are simple and they lead on to more complicated ones, and they're there basically to make you think. And if you have questions in the meantime, please throw them across. We can't cover the whole topic, so we've tried to pick out a couple of main ones by introducing them via case study. So,
and then we also decided to talk about artificial breeding and their pitfalls, because this is kind of a question that we would get a lot from owners, you know, like, what stallion should we be using, you know, can I go frozen with a problem mare, and different things like that. So it's just to kind of point out, you know, the differences. Sue's going to talk in detail about it, and we'll have a discussion about that topic as well. And then, you know, your mare is in foal, you know, that's brilliant. Now what do I do? So
the mare's in foal at 14 days, about the other 10 months and 2 weeks, basically.
And then there's obviously, you know, my mare's not in foal. Is this the end for her, or, you know, is there anything we can do? So, you know, what's next for her? So that's kind of the overview that we've kind of decided that we'd have a chat today. But obviously, if anyone has anything else they'd like to add, just drop Wendy a question and we'd be delighted to answer that. So we've broken the mares, I suppose, into two types according to their history. So you've got the type 1. These are the misunderstood mares that need a little bit of extra veterinary attention. And then you've got the type 2, and these are maybe the more complicated mares that have received standard veterinary intervention but need further investigation. And so we'll move on to the case studies. So the first case study that we're going to talk about is Sally. So Sally came to us last season. She's a beautiful 10-year-old Arab mare. She had 3 foals previously. The owner ran her with the stallion the season before, and she didn't go in foal. The vet was only used to carry out a pregnancy scan mid-season and a scan at the end of season, and unfortunately they were both negative. They did see the mare being covered by the stallion on multiple occasions, and other mares that ran with that stallion did go in foal. So she came to our farm early in the season last year, and Sue was given her to try and work her magic on her. So
basically, when I'm presented with a history like this, where, you know, and it's not uncommon, everyone has their own style of wanting to try and get their mare in foal. And these tend to be the ones where the client might not want to get the vet in because it's costly, whatever the reason is, or maybe it's just their style. But, you know, running the mare with the stallion and she comes up not in foal on a couple of different occasions, well, what's your next step? You're going to have to consider some further veterinary intervention other than just scanning her when she's out of season, presumed to possibly be pregnant. So basically, the client came to the farm, was very frustrated. Animal hadn't gone in foal at all last year and was run with the stallion for a period of time last year as well, and still not in foal. So, you know, I have to take that as though it could be complicated or it might not be complicated. Is she misunderstood, and the frustrations of the clients, you know, are easily alleviated, I guess. So basically, I check over the mare, and she looked totally healthy. She had good teeth, she had good feet, she had a nice shiny coat, she was on a good deworming protocol, and she wasn't sunken in behind when I looked at her. And then I scanned her, and she was in season, she had good oedema, she had a 40 follicle, there was no fluid in her uterus, there was no signs of any issues. So we decided it, you know, and I'm presented with this history of not multiple scans last year. So on the first cycle, when it's presented to me with no visual complications or no major complications in the history, I want to give the mare the benefit of the doubt. So she had a large 40 follicle, she had good oedema, she had a nice open cervix. So I chose to indicate cover that day. I gave her an ovulation drug, and that allows for timed ovulation roughly 36 to 42 hours after the injection's been given. She was given the drug at live cover. She was given 1 cover with a known fertile stallion, and she was scanned 2 days later for ovulation. She had ovulated. She had some fluid in her uterus. So we flushed out her uterus, and I kindly asked Aoife to give some medications to help spit out any ongoing fluid, because when these mares are covered, they all have what's called a transient endometritis. So they basically have an inflammation in their uterus, which in the healthy mare is transient. It tends to go away within 6 hours, and some need a little bit more help. And this was the case with this mare. So we indicated oxytocin after the flush, and I checked her the next day after that again, and she was lovely and clean. And she came up pregnant at 15 days post-cover, so 13 days post-ovulation. And I suppose the message realistically in this one is a stallion will cover a mare possibly on multiple occasions while she's in season, and a stallion will even cover a mare after they've ovulated because they can remain in season for a number of days after ovulation. And that, in this case, may well have been the problem, in that the mare was just creating too much of a reaction to the multiple covers. So I think the magic in this scenario was one cover, little bit of veterinary intervention, and an ovulation drug, and maybe the flush as well.
And given that this mare had, you know, this scenario, from what I gather, had happened previously, like she had run with the stallion before and she had gone in foal before, am I right in saying that?
Yeah, but we all get older.
Exactly.
We all get older. And I'm presented with
As I'm testament to it, my grey hairs at this stage.
we do. We all get older, and I guess I'm presented with that, you know, and it is frustrating. You have a mare who's had a number of foals before, and why is she suddenly a problem? Well, you know, most things go south for most people as we get older, and it's the exact same with the mare. So if a mare has had a number of foals, you can feel, sometimes you can even feel where the baby was in the uterus the year before. So, you know, at some point, some mares need that extra, you know, this mare is just veering into that period of needing an extra little bit of help.
And as much as this is relating to, you know, a mare that's running with stallions, the same issue can arise, you know, in managed covering scenarios as well.
Absolutely, yeah.
And I suppose the other thing to point out, I mean, we're you know, you've referenced here an Arab mare, and this the breed is inconsequential.
The breed is totally inconsequential. I suppose I could add an extra layer of complication to this case and, you know, pretend that Sally the Arab actually had 2 ovulations at the 15-day check, or at the ovulation check, and she turned up to, at the ovulation check, and then she turned up to have twins at 15 days, you know. And that's, again, in my mind, a good reason to have a little bit of veterinary intervention, because we can choose which one to get rid of, basically, and reduce the risk of the mare having foaling complications with twins next season. So
this is, you know, this is reasonably typical of what you will come across out there in your work.
Yeah. And statistically, older mares produce more ovulations and are therefore more likely to twin.
So, will we move on to the next one? And
that's the nice easy one. We better give them something a little bit more.
Yeah, more complicated as we go. Yeah.
So you can move to case study 2. So this was Annie. Yeah. So she was an Irish sports horse. She was 14. She was really well bred. She had 9 foals previously, so it was her whole career as being a broodmare. Never had an issue going in foal. She had been covered both naturally and artificial with chilled and frozen, and never had an issue. And then she was tried multiple times, but it wasn't happening for her. So as you can imagine, as a breeder, you'd be fairly kind of annoyed that she's not going in foal. So she came to Sue, and Sue recommended.
Basically, you know, again, listening to the history, that for me is the most important bit, really getting a detailed history of the mare. And it sounded like there probably was a little bit more veterinary, you know, the mare had been scanned and things like that. So, and, you know, just asking the client, was the mare ever swabbed? Was there any further investigation done other than, you know, the veterinary intervention that I've mentioned on the last case. So the mare had an ovulation drug on each cover, and she was scanned on each one. But listening a little bit deeper, there was never any investigations with swabs for bacteria growing in the uterus or endometritis or anything like that. So that was the step. Basically, mare comes to the stock. She looks totally healthy on the outside on clinical examination. And I scan her, and she has some fluids. So I then choose to use so there's a couple of different ways to swab a mare. I've taken out one, and this is the standard one I use, the cervical swabbing, which is going in with a swab and just swabbing around the cervix. But the more standard way of doing it is by using this guarded swab. And this actually inserts in through the cervix all the way into the uterus, which is where you're trying to get a representative picture of what's going on. And the first bit pops out here. So, you know, it's guarded. So that's the first bit. And then you have the swab, and 10 seconds of contact time, rolling it around and pop it back in. And there we go. And I take it home and I plate it up on 2 different types of agar plate, and we get a BHS. I'm trying to get it up here. So
Good woman, Sue.
This is an agar plate, yeah. So this is a BHS. It's a fairly stereotypical picture in a mare's uterus. They get either E. coli's or BHS normally. So this grew at 24 hours. It's a relatively heavy growth. And then, you know, I'm going to talk later about protecting our antibiotics, but very important basically to try and move away from empirical use of antibiotics. So we do sensitivities basically on anything that we grow that looks significant. So at 24 hours, she had the BHS, and then we did the sensitivities on plates. And at 48 hours after initially plating up, it showed that she was sensitive to penicillin. So what did I do? We basically decided she had quite a lot of oedema in her uterus and some fluid. So I chose to do a flush on that cycle and just take our time. You know, there was no rush on getting her covered on that cycle. Sometimes we do treat and cover on the same cycle, but in this instance, I chose to use intrauterine antibiotics for 3 days until she looked nice and clean. And we skipped the cycle, we PG'd her back in, and she was nice and clean for the next cycle, and she went in full. So again, not a complicated one. It just needed a little layer up, another level up on the intervention. And you know.
And what's the thinking around skipping the cycle? What is your reason for doing that?
Well, to be honest, like dealing with thoroughbred farms every day, I try not to skip cycles because you have a really limited amount of time. So often I will indicate that the mare is covered. So you know, you might flush her before cover, and if she has a reasonable amount of fluid, and cover and then treat afterwards. But the idea of skipping the cycle, if the luxury exists with time, the idea of skipping the cycle is to allow that 16-day period when she's out of season for the uterus to calm down and heal, because it's had a bacterial infection in there. So you're increasing your chances of getting a pregnancy if you skip the cycle. But good results and good statistics, because I review the stats at the end of each season, and good statistics when choosing certain cycles to treat and cover on the same cycle.
And you know, I mean, you are a team as far as, you know, the efforts to get a mare in foal, and you know, so much of what we're talking about at the moment is dealing with the physiological side of this, or the, you know, the nuts and bolts of the repro side of it. How much of a how much of a part has the healthy mare, the happy mare, got to do with the actual end outcome and the work that Aoife is doing, and the instruct that you leave, and what Aoife is doing in her part at home?
Yeah, no, good point. So the immune system of an animal is a delicate balance and an outcome of the health and the care that it receives. So if they are, out on good grass, their teeth are well maintained, this is all stuff that I think we're going to talk about on a separate slide. But the long and the short of it is, the antibiotics that we use for these things work best when the immune system of the animal is at its optimum. So it's not just an interaction of the bacteria and the antibiotic, it's also the immune system of the animal in order to be able to help fight it off as well. So it's very important.
And Aoife, like, over the period that you've been working with Sue, what do you feel like that you have changed most about how you approach the management of mares? Or is there any one thing, or is it a combination of things? Or what has she got the whip out most with you about since you started working together?
Shared an oxytocin.
Yeah, shared oxytocin. So I suppose, like, we were lucky that, like, a lot of our mares go and foal quite easily. So I hadn't experienced much of the whole problem mare history. And like, when Sue was telling me, you need to give X, Y, and Z at this time, that time, you need to lunge her, you need to do this, I was like, oh, here, do I really need to do all of this? Is this like really necessary? But I suppose because I didn't have to experience that with our own horses, it was only then, like I said in the beginning, when you went to the next day and Sue would scan and she'd say, oh, this is working, look at this, and she'd show you on the scan, like, and there'd be lower fluid, less fluid, and things like that.
You believed in it when you said it.
And that as well. So then, like,
but not your own mares, like the complicated
ones, yeah. So,
but like, I'm assuming, that some of this, of what you're talking about, is like the kind of mares that've been dirty mares and mares with fluid and so forth, and you're talking about get them clean, keep them clean kind of way.
We're not indicating, like, if a mare doesn't look like she needs all of what Aoife is discussing, then it's not indicated. There's no point in throwing the kitchen sink
at it unless the kitchen sink is required.
That's it.
So like, where you were talking about the oxytocin and the mares that need lunging and so forth, they're mares that have been dirty or have had fluid up or whatnot, and you're about trying to get them clean and then keep them clean.
Well, it depends on the mare. So for every mare, like, what I've noticed is every mare has a different protocol. So not one mare,
they're all unique.
They're all unique. So it depends what Sue sees, even on that day. So Sue,
what surprised you most?
Just
individuality.
Yeah, individuality. So like you might be doing something one day, and then with a mare, like, so. And then Sue would say, okay, this isn't working, we have to change it. And then the next day, so every day is different. And like, after ovulation, like Sue always says, you have 5 days to have that mare clean and right before, she completely closes up. And you have to work really hard for those 5 days, depending on the mare, isn't it?
Depending on the mare.
Yeah. And then like, the favorite part is when you're scanning the mare and she's in foal. That's when it's like, okay, it was all worth it, this is a big win, and everyone feels happy.
That's it. But it's the approach, you have to take the client into consideration with the approaches as well. So I think it's really important, like the problem scenarios that Aoife's bringing in with loads of oxytocin and heavy management. The budget of those things needs to be discussed with the clients and given a
due consideration.
Yeah, and there's one brilliant client from last year, and this person just is a hobby breeder, and I was adamant on explaining to him, because he had like 2 or 3 very complicated mares, and explaining to him the costs involved and the potential outcome. What's the possibility? What is the chance of this mare actually going in foal? So I think you know, being very clear about expectations and having those discussions before you begin these intense procedures and plans is very important. But again, we're not even onto those complicated mares.
Yeah,
like,
I've another one on the screen here waiting for you.
So who do we have? Oh yeah, Cassie. So Cassie was a 16-year-old Irish draft maiden mare. She was lovely. She performed regularly on the show and circuit. She was one of those really nice mares.
Didn't that just make her up? No.
That's what I thought.
Ridden by the whole family, and now they would like to have a foal. So this was a regular kind of, we got a lot of these mares last year. She was tried but never successful, and then the scans repeatedly showed fluid. So if it wasn't Cassie, it was you know, maybe a mare that someone had that maybe got injured, and this was now their new, you know, career that they wanted for them. Or yeah, we got a lot of older maiden mares.
Yeah, so where am I at with her? Yes, so I mean, I get these phone calls, and the thing certainly, and this history is very typical, older maiden. So immediately before I've even scanned the mare, she's old and she's a maiden, so I know that it is likely, not guaranteed, but likely that her cervix is going to be the issue. So basically, when a younger mare goes in foal and they have their foal, it opens up the cervix and it changes the whole architecture of the cervix, actually. And it allows it to have more elasticity on each cycle. So they can actually have quite an open cervix when they are in season. But the older maiden, and not all older maidens, again, it's all individual. I've had like younger maidens present like older maidens, and older maidens not so bad. But certainly in Cassie's case, she had a really tight cervix. So, and there's two scenarios there. Some mares with such a tight cervix, the stallion may not even be able to cover them properly, because the semen needs to go into the uterus for the sperm to actually make it up to the oviducts and fertilize the egg. So in Cassie's case, when I really dug down into the history, when the mare was covered, sometimes a lot of the fluid would spit out afterwards, you know, so that's another indicator that the door of the cervix is not open. Okay, so where do we go from there? I scanned her, and she had a really angry uterus with a reasonable amount of fluid in her uterus. And then I checked her cervix, and her cervix was tight. So we were then on a mission to do a bit of a cleanup on her uterus, which is a naive space, like she hasn't had a baby in there. And we cleaned her up as per a similar protocol on the last mare, with the swab and antibiotics and some flushes. And on each flush, it was just the cervix would open up a little bit more and a little bit more. And we chose to eye this mare with a really, really fertile stallion, and give the ovulation drugs actually after the cover, which allowed us more time to clean up that uterus. And she was flushed very soon after cover to remove all the debris that causes a reaction within the uterus. And when you're removing, because you know it takes 500 million sperm to get a mare in foal, it's not just one, but all the rest of the debris doesn't need to be in there for any length of time. So a number of hours after the cover, we flushed her and gave her anti-inflammatories, dexamethasone, to deaden down the reaction. And we worked really hard to make sure that all that fluid was spat out of the uterus, basically. And a mare like this doesn't just miraculously necessarily go and foal on the first cycle. I think it's really important. If it's a really bad cervix, then again, you know, comes down to the individual. But I remember with this scenario, we I advised the client that it was probably going to take a number of cycles to catch her. And it took more than one cycle, but I think we caught her on the third cycle. So, and often when they have the foal, the cervix isn't an issue then the year afterwards. So once they can go in foal and carry the foal to term and give birth, it normally rectifies the problem of the older maiden cervix.
But not like, would you say, like all maidens, they won't? I know all older maidens mightn't go in foal, or would they?
No, I think they're all individuals.
They're all individuals, yeah.
You know, it's the same as, sorry, it's the same as women.
Yeah.
Basically, like it is, you know, some women need IVF earlier than others, and then you might have, you know, big variations. So no, and that's why the clinical examination is so important. To be able
Each case on its own merits or lack of merits.
Exactly, that's it.
Yeah.
And to be able to really evaluate the individual, and once you've evaluated the individual, then you can go ahead and advise the client on what the best protocol is and what the possible outcome is.
But like if you were to say, I suppose, you know, whether there is an issue or not, in the sense of what most of us would describe infertility issue, or you know, not a fluidity about going in foal, that aside, what would you say are the key things to do in a clinical fashion, if you like, before you go about trying to inseminate a mare or to have a mare covered, whether it's live cover or artificial insemination, whatever the mode is? What are the key investigatives that you should do before you do that? In
a problem mare or a normal mare?
In a normal mare, even to start with, what's your minimum suite that you'd like to see people do?
Well, the minimum, so again, it like, I hate saying this because I'd love to be able to treat every mare appropriately. Well, when I say that they're all treated appropriately, but you do, me personally, I do try and design the protocol to the budget of the client, basically. So, you know, if you have someone who's run a mare with the stallions, etc., if I feel that mare needs a swab, I really need to discuss the costs of those things. And they're not big costs, but I think it's very important to make the mare aware. But certainly the minimum things for me are scan, evaluate whether I think there's an issue on scan and on the clinical examination. And if there is any fluid in the uterus, I like to be able to, sorry about this now. That's 2 phone calls, but it's my uncle, so it's not an emergency.
my heart does a jump every time you're
I know, I'm like, please, no.
He should be lumped into this, so I don't know why he's a vet as well.
Yeah, ignore him, keep going.
So, you know, if there's fluid there, I want to be able to do a swab. If she's a very complicated mare that's had a really bad history, I don't only want to do a swab, but I might want to do what's called a small volume lavage, which is less standard and the next level up on investigating. And the reason for that is that little area there is only representative of literally the top of the swab of a hole inside of a uterus, you know? So the minimums for me are scan and get do a really, not that all the scans are detailed, but gather as much information as you possibly can on the scan, on the clinical examination, and the use of ovulation drugs, and finding out, you know, is the stallion for live cover fertile? Is he old? Is he busy? What is he? And timing the ovulation drug to the stallion and the mare in question. If she's a normal mare, then she can take the ovulation drugs earlier. But in the likes of Cassie's situation, then you want to give the ovulation drugs later, after cover. And then an ovulation check and treatment on that ovulation check. Or maybe a check prior to that if she's a very complicated, difficult mare. as mentioned with Cassie, who was checked very soon after cover. So again, what are the minimums? The minimums come down to the animal in question, you know.
Yeah, absolutely. There's actually a bunch of questions in here, and I'm looking at the time, so I think what I'm going to do is I'm going to pitch some of these questions to you first, and then we can come back into another case study if that's okay with you ladies. Yeah. So I'm trying to see where to go first. I'm a breeder starting out. I've one well-bred mare which I bought in foal. She foaled down well and cleaned, all went great. Tried getting her back in foal on the foal heap, but unfortunately that didn't work out. And on over 2 cycles, and then the stud requested me to bring down the mare so they could examine her and try to get her in foal themselves. So they were doing AI at home. Trying to catch up on last time. What's the best approach from there?
Sorry, the mare was covered on foal heat. Mm-hmm. And then
mare was covered on foal heat and didn't go in foal. And they obviously tried over 2 cycles, okay. And now the stud have requested that the mare travel there.
Yeah, so I would probably go with what the stud has suggested. Because the first thing I'd say, like, I guess, again, I would want more history here. So the questions that I would like to ask the person who has put this question forward is, was she scanned on foal heat? I presume she was. And then, you know, foal heat, there's certain criteria that we take into consideration in order to be able to use foal heat. If there's any fluid there, don't use it. When I'm palpating the mare, if she feels like she's got a big part of her uterus where the baby sits, if she's not being correctly involuted, or if she hasn't correctly involuted, then I wouldn't use it. But anyway, that's not the question that this lady's asked. She's asked, what do I do? Quite simply, I would run with what the stud has suggested. And it sounds like this mare just needs a bit more help. If has she had foals before? Yes, well, the foal heat. It sounds to me, if she has a foaled foot, it sounds to me like she should not be a complicated mare. She just needs a bit more veterinary intervention. And I think it sounds like a sensible option to send her down to the stud farm to allow them to do work.
Yeah. So I'll chuck another few at you here. How long after covering or ovulation can oxytocin be given?
Very good question. So the standard belief was 6 hours, but I was at a conference with all the world specialists in the off season, and there are people using oxytocin an hour after cover. That's not my protocol. That's not what I use, but certainly the standards, you know, is 6 hours, and or in order to be able to work in with people's lives and management, like if they're covered at 6 p.m, then I'd only ever ask Aoife to give oxytocin at midnight. If they're scanned at if they're covered at 6 p.m, then give it the next day, give it the next morning. But yes, 6 hours. Some people give it 4 hours. He's really persistent. I'm going to turn my phone off.
Okay, flushing a mare's fallopian tubes, success rates and costs. Even success rates, we might be able to leave the costs.
Yeah, so good question. Costs depends on the hospital. The first thing I'd say on, so it's prostaglandin, it's a gel on the oviducts. Well, there's 2 ways of doing it. You can do a laparoscopic surgical technique, which goes in.
And maybe, Sue, for those who maybe wouldn't know why you might do that, maybe also to explain that.
Well, it's a good question. So I come across quite a number of mares that just didn't go in full, and then suddenly it was recommended that they go for flushing, or PG on their oviducts. I would absolutely encourage people, because it is costly to go into a hospital environment and have this done. So the first thing I'd encourage people to do is make sure the mare has had an appropriate workup, which includes a biopsy. of the uterus. So basically the only indication for doing that particular technique is if literally there are no other problems to be found. That's realistically the only, if you get to the end of the season and you find that she has a bacterial infection or other things come up on the biopsy, then you're probably better off treating those other things before you jump into that, okay? So success rate comes down to the individual cases chosen. If the correct cases are chosen, so, and it's literally a matter of obliterating all other possibilities, and you're down to a perfect mare that just continuously will not go and foal. They are the only ones that warrant that particular technique. End of story. And the success rates are really, really good. Maybe not the cycle, maybe not the cycle of the flushing or the cycle afterwards, but certainly the third one. And there is an alternative technique where you take misoprostol tablets and you dissolve them in a ml or 2 mils of sterile water, and you deporn and seminate. So instead of going in on the sides of the mare via a laparoscopic technique and putting the gel on the oviducts, you have the option of going up into the uterus, up to the entrance of the oviduct and placing those dissolved tablets up there. And the idea is to shake out any gunge that's in the oviducts that might be blocking a perfectly healthy pregnancy from moving down into the uterus. That's the idea of it. Success rates in the correctly chosen animals are really good, but I have come across time and time again, here's my problem mare. She had her oviduct flushed last year and she's still not going in full. What do I do? And then I do a biopsy and I discover that actually she has loads of fibrosis, or she has clogged up glands in her uterus and she needs exfoliation curettage, so I wouldn't jump in on that technique without doing the correct workup.
The steps before.
Yeah.
Another one I'm going to throw at you here, I'm just watching the clock is moving on as well. I have a maiden under lights in December, hasn't coated out fully, just started cycling but didn't ovulate in the first cycle, also teases and stands for cover while having her PRID inserted. She also acts like a teaser in the paddock and teases other mares when they are in season. Is this normal? Abnormal, even.
So,
and is it normal or abnormal? Will I go through it quickly again?
Yeah.
So maiden, under lights since December, hasn't coated out fully, just started cycling, didn't ovulate on the first cycle, teases and stands for cover while having a PRID inserted, also acts like a teaser in the paddock.
Yeah, okay, well, it'd be fairly unusual to have a PRID inserted at the time of cover. But yeah, okay, go on.
And teases other mares when they're in season.
So I'm picking up on a mixture of different things. Okay, so great, she was under lights. She didn't ovulate on the first cycle of the season, but she stands for cover. And so I'm picking out the red herrings. I suppose without having more information here, I suppose the red herrings there for me would be, I would probably ignore the fact that she behaves slightly strange with, or perceived to be behaving strangely, teasing other mares. And I would question the PRID with proximity to cover. I would also question, because there's two types of PRIDs. There's one that lasts for 7 days and there's another one that lasts for 10 days. Sorry, there's one that lasts for 5 days and there's one that lasts for 7 days. So I would probably, I'd need a little bit more information.
Need more information to be able to answer it fully.
More information on that one. But and I'd also probably want more information on the light program that was used, because the lights need to be really, really quite bright. You need to be able to read a newspaper in every corner of the barn. And my hunch on this one would be to give the mare the benefit of the doubt, actually. And, you know, if you want to contact us, and I can answer more questions. Like our email and phone numbers and stuff are at the end. If you have more questions about that case, I'm happy to answer anything else, but I'd probably need a little bit.
I'll throw a short one at you for now. Do cysts change in number or size over time, and can they be cleared?
Oh, such a good question. Okay. Do cysts change? Yes, absolutely. So, I mean, you know, I see mares all the time that had no cysts last year, then they go and foal, and now they come back this year after having a foal, and there's plenty of cysts there. So yes, why? I suppose the big question is, why do cysts exist? And often it's because of a lymphatic drainage issue within the mare's uterus. So yes, they can. The cysts absolutely can change shape, and then it also depends on what point in the cycle you're scanning, because they can look different. So the cysts themselves don't necessarily change from week to week, but they look different on the scan depending on whether the mare is in estrus or in diestrus. Okay, so that's the first thing I'd say. There's variations on how they look at different points in their cycle depending on when you're scanning. And yes, absolutely, they can get bigger. I've never seen one disappear unless I've removed it. And then there's a couple of different ways to get rid of cysts. You can have them lasered off in a hospital environment, which is considered to be the gold standards. And then also, you know, specialists and people like John Newcomb, who's pretty much a godfather of reproduction over in the UK, will happily put his hand in and twist off the cyst. You know, doesn't mean she's not going to pop up a cyst somewhere else, because the root problem isn't solved with a lymphatic drainage issue. But yeah, they can be frustrating.
I have another one. I have another one here I'm going to throw at you, Sue, if that's okay. We have a 23-year-old warm blood mare. She's bred a number of foals. She foaled fine this year. However, the foal died after a few minutes, and the person who foaled her could see no obvious reason for the death. Would you recommend breeding this mare again, as she's now 23 years of age? She didn't have a dead foal before.
Yeah, so the first thing I'd say is, if anyone is in that scenario, you can always send the dead animal, the dead foal and the placenta up to the equine centre, and Ursula who does all the autopsies, will give you results. It's a free of charge service, and you know, it's a free of charge service, and you get great information on what the cause of death was. So I would give this mare the benefit of the doubt. She carried to term, but the foal was dead at birth. So I would give this mare the benefit of the doubt, and I would consider some further workup. 23 years of age, I'd probably choose to do a biopsy to find out what the integrity and the health of the inside of the uterus is to carry, because you have the baby and you have the home of the baby, and they both need to be able to interact in a healthy manner.
So there's actually a couple of questions in here that are kind of relating back to AI and different kinds of semen and so forth. So I think maybe if we might spend a couple of minutes, it's 25 past now at the moment, so we might just spend a little bit of time, and if we have still some time, I can go back into some of those case studies. But if we talk a little bit around, because it is so common out there, the different issues that arise around use of different kind of semen, and like you said, Aoife, you know, the person that comes to you and is asking, you know, well, should I consider frozen semen with this mare? She's been a bit difficult and whatnot. Maybe if we could go there for a couple of minutes, ladies.
Yeah, I suppose like anyone that's coming to the farm, well, obviously it depends on their mare. So it depends on their history, and then their vet would recommend if they're a candidate for, you know, chilled or frozen semen.
Yeah, like that Cassie mare, the 16-year-old maiden, not a candidate easily for frozen semen.
Yeah. And then as well, like sometimes like you would prefer natural cover for some of the more difficult.
Yeah.
But like depending on what you go for as well, like I would always recommend people to have a plan B option. So regardless what stallion you're using, like time after time, how many times last year did we see that the stallion that people wanted, you know, maybe was injured or the semen didn't arrive from abroad, or, you know, regardless what it is, so that
Having a backup
yeah,
plan.
have a backup plan, because when you have paid all this money to line up your mare and she needs to be covered at X, Y, and Z, and then you're told that the stallion that you picked isn't going to be available, you know, it's good to know in advance
and just to understand, so what is fresh semen? So there's 3 brackets, and I see people getting confused between these brackets all the time. There is fresh semen, which is effectively the same as live cover, thereabouts. And then there is chilled semen, and that means that it's been processed and extended and put into a box with some cold blocks. And it might be travelled only 5 minutes down the road, but equally it might be coming from mainland Europe, okay? And that is a really important consideration and thing to keep in mind. So first off, you know, the semen has a lifespan, and it is dying while it's in transit from, you know, Holland or wherever it is. It's dying when it's in transit 5 minutes down the road as well, but you're going to receive a, you know, that's where you're considering the timing of your ovulation. So if you're getting stuff from mainland Europe, and that normally arrives in the morning time, you have the option of, let's say it's Monday night, you give the mare the ovulation drugs late on the Monday night, let's say midnight, and that should have her timed to ovulate on the Wednesday morning. And that you're basically treating that chilled semen almost like frozen semen because it's been in transit for so long, okay? So they're really important considerations. And what Aoife said about having a backup plan, if you're paying a substantial amount of money, which people do on with artificial processed semen, then you know, never a bad idea to have a frozen option in the background just in case that semen gets lost by the courier or whatever it is. And speaking to Tullis Matson at Stallion AI, like when Brexit and all these different things kicked off, that was actually quite common. So, you know, how many cycles are you going to miss unless you have a backup plan? So, yeah.
And then, like, do you want to talk a bit more about frozen? So, like, when clients come to Susan and they tell her that they have one straw frozen and they bought it in an auction, you can literally see the sweats rolling off her forehead.
Colours draining from her face.
Not always, but I think it takes more than one sperm to get a pregnancy. Therefore, sometimes, like, it depends on what the proven dose of the stallion is, okay? So you need 250 million progressively motile sperm, standards, thereabouts. Stallions are individuals, so, you know, there's variations on it, but there's a standard dose of frozen semen. And if that's proven to work over the course of a season to get loads of mares in foal, then you might find that the dose is reduced slightly the year afterwards. And then if that works really well, it might be reduced then even more. So there are some stallions that are really good at getting a mare in foal on one straw. And then there's other stallions that need the full dose, which can be 6, 8 straws, whatever it is. So, you know, there's companies out there like Stallion AI or Euro Stallions or whatever. So it's always good to have a chat with them about the performance of the stallion on the dose that's being given, because you might be
talk to the breeders, I suppose, as well, and their experiences.
Breeders, do you know what I mean? But like, if you're getting a cheapy dose off an auction, which is, you know, a dose being one straw, you might well be better off to consider something else, you know, or give it a try, but at least I have the opportunity to manage your expectations on that one straw. And when We defrost the straw. We have a look at it under the microscope to see the quality of it, and you get a fair idea of what has been used to extend it, etc. So very important to evaluate the semen at insemination. Very important.
I think that's a critical point.
Yeah.
There's a couple of other questions that come in here. Would you prefer, and this is quite a technical question now, would you prefer HCG injection, 3000 IU, Coriolan, or Ovuplant, or Dazarlan to induce ovulation, and why? That's a really technical question now for you, Sue.
Oh, a good one. No, it's really good. So all the studies, and there's a couple of different doses, like there's 1,500 international units, which is the one bottle, or 3,000, which is the 2 bottles of Coriolan. Coriolan works perfectly well, and at the moment it is the only licensed ovulation drug in Ireland. Ovuplant is now off the market. It went off the market in the beginning of last breed season, and the prices went up, and we all hoarded it into our vet practices, and it's no longer available. And what is down in my stock is out of date, so I'm not going to use it, But in other countries, they have Deslorelin injectable, which is licensed, and all the studies prove that Deslorelin is a much more effective ovulation drug than Coriolan. And studies have been done over in Australia by Angus McKinnon. They've been done all over the world, really. And then the most recent one, Bova, that makes Deslorelin, now sells it over in the UK. So James Crabtree's practice did a study on it for the UK population of mares and compared it to Coriolan. And it is better, there's no question about it. But I suppose at the moment, the only licensed drug that we have to use in this country is Coriolan. Therefore, the only option you have this season is Coriolan.
I know, Aoife, there was a case study in this, and what you'd set out, that was relation to body condition of the mare, was relation to the mare that was overweight and the mare that was underweight. And in general, I suppose, correct body condition and good nutrition, sound nutrition is a big part of having a healthy mare as well to go into the process. Do you want to pay a mention to that, in the sense that it was there as one of the topics you wanted to allude to?
I suppose last season we got a lot of mares that were in too good condition, so they were really, really obese, and it was to the point that Sue would have to send them away and tell them to put them on a diet, because obviously if they're too big, they're going to have difficulties going in foal, and the same if they're too skinny. There's conformation issues, isn't it, behind and things.
Yeah, so
and then they're just not healthy.
So the statistics studies show that the overweight mare has less of a chance of going in foal than the slightly underweight mare. So just from a watching the process point of view, it can be difficult for very overweight mares to actually spit fluid out. But equally, if they're very skinny, it means that there's no positive pressure to allow them to spit out fluid as well. So, and then you have to take into consideration why they're overweight. Is it equine metabolic syndrome? Is it because they have Cushing syndrome? If it's Cushing syndrome, then they're probably best off going on Prasend for various different reasons. And one of them is that the Cushing syndrome mare can throw up HAFs, so basically follicles that don't ovulate correctly. And then the skinny mare, well, management-wise, if she's super skinny, why is that? Does she need to go on a deworming protocol? Does she need her teeth done? Is she just a bad doer and needs that extra TLC? You need to prep these mares for date night. That's basically the way I see it. You know?
I love that.
Well, that's it in a nutshell. You want them in their peak condition for date night, you know, and that's what's going to give them the best chance of going in full. Yeah.
Good analogy. Good analogy. Yeah. Okay. And because I am watching the clock as well too, I suppose, you know, you did say that you wanted to talk a little bit about the mare that is in foal, and you know she's now in foal, and you've scanned her, whatever, whether it's been 14 days or whatever after ovulation. What's next? What's after that? She's going to stay happily in foal and all is going to be well, or there are potential things that can go wrong
Well,
and should be kept an eye on?
The mares in foal, what next? I break those mares into two categories. The mare that's never had a problem before, I don't really see any reason to go checking her again, other than obviously a heartbeat check, and maybe if she's had 2 ovulations, then a twin check, and maybe a 45-day check. Fairly standard, scan them up to 65 days on the thoroughbred farm. So 14-day check, 16-day check, 30-day check, 45, 65. If she's not a problem, I don't really see the point in checking her again unless she's showing an issue, so bagging up too early, or, you know, producing discharge from her vulva. But the mares that have a history of slipping, then I absolutely think that they warrant checks. It's the same thing again. I try and compare these things to our everyday life. If it's a lady that's had a couple of miscarriages, then she's probably going to have a couple of extra scans advised by her gynecologist. Do you know what I mean? So in those cases, you know, the 45, 65 day check, and then checking the placenta, you know, so coming in at 100 or 120 days for checks on the placenta, fairly standard on big thoroughbred farms to have a population of problem mares that are scanned once a month at that point. And then you're trying to, you know, treat any abnormalities that you find. If there's a thickened placenta, if there's placental separation, you know, if you don't look, you don't find.
And then the mare that is not in foal, and, you know, where to next?
Well, we got a lot of these the end of the season.
You just send them up to Aoife.
Yeah.
Send them to Aoife.
But like we were getting,
I'm going to push you now on time to try and get this across the line.
So basically, look, the 2 best times, you have a mare at the end of the season, she's not in foal. The 2 best times to evaluate that mare are at the end of the season or before next season starts. And you know, then you're coming into diagnostics, like taking biopsies, doing small volume lavages, trying to identify the reasons why she didn't go in foal, treat them accordingly. And the best thing about the off season is it gives that mare a chance to heal and totally normalize before you embark on next season. And without a doubt, that's the time to be doing it, you know, not in the middle of the breed season when you're trying to cover and treat all at the same time.
And for you, Aoife, like, how much of an impact does it have on a mare when she, you know, because we're all different as humans, we're all different as well, and we all react differently to different situations and have different levels of stress to different situations. And I do think stress affects us all, you know, even when we don't realize it's actually affecting us.
Yeah.
How much of an impact does stress, in the sense of whether it is changing the group structure that a mare has, or, you know, being pulled away from her stable friends, or, you know, transport, all of these things that we impinge on animals to get from them what we want to get from them?
Oh yeah, definitely. Like, so before a mare would travel to our farm, like, I'd always get as much of their background from the owner. So if they like to be with other horses, if they don't, if they, you know, so they would kind of tell me their normal day to day. And when they come to the farm, we try and do that as close as we can. And you'll see it more so with mares that are going for foaling as well, because obviously when they're coming to us for foal, you want to keep their stress levels down. So we even have some people who might bring their friend with them, because they don't like to be separated from them. So yeah, no, it's really important to keep the horses as happy. And we're lucky that on the farm we have quite a lot of land, and we have lots of different types of horses, so we can kind of match horses, accordingly, and try and keep them as happy as possible. But yeah, definitely, even for going in foal, for everything, you want to keep them as happy and stress-free as you can.
And in relation to the two case studies that we didn't sort of hit, we mentioned the weight issue. So the last one, the 9-year-old mare that had 2 foals previously and had been tried for 2 years and didn't go on foal, and had all the bells and whistles, and no vet could find anything wrong. Were there points that you particularly wanted to bring to bear on that one?
Yeah, it's kind of been covered in the PG flushing of the oviducts question that came up. So, had all the bells and whistles in standard fashion, end of the season, what did we do? Well, we did a small volume lavage rather than a swab, because it's more representative of the whole inside of the uterus. Nothing came back. She was totally clean, no fungi, no nothing. And then we went in and took a biopsy with this fairly...
I love your props. She's so well organized.
Well, this biopsy, ironically, you can take a biopsy on a mare and cover her on the same cycle. If I can get this to open up now, that would be great. There we go. So you take a biopsy, it gets sent up to Ursula at the equine center, and the mare came back with no abnormalities. She was like the perfect candidate for going in foal. They are the ones that need their oviducts, or that's the last. It's not so much that they need it, it's not a guarantee, but certainly that would be the next step. And still in certain scenarios that doesn't even work. And I had a mare a couple of years ago who was basically, her job was to go in full. She wasn't going in full, so she was sent for autopsy after being euthanized, and she had big cysts on both her oviducts, which were never going to go away. So, but yes, has had all the bells and whistles, further bells and whistles, can't find anything. That's when you're looking at PG on the oviducts.
There was a question in here from somebody as well too, in relation to ET and that side of the house. Just to say that for anybody who missed that, I did have a conversation last month with Dr. Niamh Lewis of UCD. So that topic was actually delved into, so people can go back into that recording and go back into it. There are some I didn't get to. There's, in fairness to the audience this evening, thank you very much to you. You've been very, very engaged in bobbing in questions, so much so that I haven't got to the end of all of them. And thank you all for those. And I know if there's anything that is really, where people would like to get a little bit more information, both of you are very open to being approached and asked in that. And not too much was missed, but listen, I really appreciate the time that our audience give to being with me on the journey of Let's Talk Equine, and I really appreciate both of your time this evening, particularly at this time of the year, because it is the pinnacle of your busy time, as they say, and I gather even a few mares were inseminated, Sue, this evening before you were let come in here tonight. So thanks a million for that, ladies, and I'm relieved that you didn't get called out during the last hour.
I'm gonna have to give my uncle the big finger now for all the
yeah. So look, we've managed to get an hour and 15 out of you without that falling asunder. And I just like to leave it to you to give your last sum up or your last bit of advice that you would offer to anybody out there. What is your key piece of advice to go with? And I give it to you, Sue, first, and if you can have a little think while you're doing that.
The definition of insanity is doing the same thing over and over again and expecting a different result. So, if you're finding with your mare, who may not be a problem, may be a problem, you need to take it up to the next level if she's not going in full. That's basically it.
Absolutely.
I think as a breeder, it's good to understand what your vet is doing. So like years ago, we used to just drop our mares to the stud and they would call us when they were in foal, and we weren't involved with the process. So you didn't know if your mare was a problem history or a problem or not, you know. And only till we started doing it on the farm ourselves, that was when we really realized, you know, what was happening. And then I suppose last year working with Sue, I got to see a whole range of different mares. So like it's good to educate yourself and to ask your vet questions. That's what they're there for. That's what you're paying them for. So, you know, find out what your mare is like. No offense, but you know,
I think it's really,
like most vets are very, well, like Sue is very open. Like she would share everything with the owner. The owner can stand there and be present for all the scans, and, you know, she will tell them exactly what she's seeing. And I think that's, you know, you're paying for the service, and I think that's the least you should get.
Well, you have to understand.
Yeah.
You know, there has to be some level of understanding.
And also, I guess if you aren't really on top of what is actually happening and so forth, if you do change circumstances, well, it's very difficult for you to kind of, you know, relay on the true history as well, you know. So that's so important. I keep hearing, you know, vets that I very much get the no more than when you go in to see a specialist or a consultant or a doctor, you know. I mean, if you don't give the history correctly, it's makes their job more difficult as well too, you know. So listen, I think we'll wrap up with that and appreciate everybody's time. And I am taking a little bit of a summer siesta, as I'm calling it, to try and catch up on some other jobs. It's not that I'm going away on holidays to anywhere sunny, don't you worry. There are other things to be done. And tuning out from Let's Talk Equine for now. It's hopefully going to be somewhere where we all sort of cross each other's paths a little bit more out there as well too, rather than just via the dialogue of the screen. So to those who stayed with the journey, thank you. To the ladies, thank you. And we will be seeing each other. Good night.
Thank you.